I'm meeting dermatologist Dr Nick Lowe.
Hi, Kirsten.
Hello, hi.
Dr. Lowe.
Hello.
Yeah,
nice
hi.
to meet you.
Come with me.
Thank you very much. Oh, in here.
With over 20 years' experience in the use of injectables, he's the right man to ask about Botox.
Sleeping out at me, best doctor.
Yeah, we've got a few of those. My litmus test about whether Botox should be used is, are there any lines present at rest? Are they distressing the patient? Has the patient, for example, got some dropping of the brow, some asymmetry caused by muscle activity? If they have, then they're a potential candidate for Botox.
Do you think, in the way that fashion goes, it's attracting younger people to try these cosmetic injectables?
Sadly, it is. If you start treating people in their 20s, these are going to become unnecessarily treated.
What is the appropriate age, would you say, for people?
I would say, on average, mid-30s is an appropriate age to start.
So, according to Dr Lowe, I'm at the right age to start using Botox. But, as is the case with 27-year-old Jess, there can be exceptions to the rule.
I think the key with Jess is that we're doing it for this very specific reason of correcting the drop of this pulling down of this brow. She doesn't need anything else done.
Botox is actually a brand name that over the years has become used for any cosmetic injection containing botulinum toxin type A, a highly diluted extract of the toxin made by bacteria responsible for the amount you have injected.
What does it feel like?
The first one just gave me a fright, and now it just feels probably like acupuncture. It's just the thought of a needle, isn't it?
Yes, I never like to see if I'm having injections or blood taken or anything. I don't like to see.
There we go. Okay, good. So that will start working in about the next 3 days, and then it will give you the maximum benefit at about 7 to 8 days.
Rosanna is here for dermal filler injections, which work in a completely different way to Botox.
I'm not going to overdo it. I'm just going to do one syringe on each side, okay? So you can always...
Dermal filler is a thick, gel-like substance, which in this case is made from hyaluronic acid, something that's found naturally in the body. Other types can be made from collagen derived from animals or humans.
It's injected me for about the last 10 or 12 years.
Really?
Yeah.
What, as practice?
No, not practice. No, to stop my... keep me looking slightly younger than I actually am.
So you're keeping it in the family.
So I've seen both Botox and fillers in action. Now Dr Lowe has agreed to assess my face to see whether I could do with some work.
This consultation may well change my world. Because if I'm going to take anybody seriously about this, it's this bloke, I reckon. Look at this, still coming off. Right, that's me. What have you got here then?
What have I got here is a special booth that has some very sophisticated camera systems that have different filters in it.
Okay.
And this will measure how much sun damage you've got. We can even measure the degree of wrinkling that you've got, so that if we're trying to look at the effects of treatment, we can follow those effects. Make a deep frown. Really scrunch your nose. Now, do you think you can hold it there? Hold it there, hold it there, hold it there, hold it there. Don't move, don't move, don't move. Open your eyes, sit back and relax. What we can see here is that you're pulling this right brow down much more than the left. And it's this muscle. You see how you've got more wrinkles on this right side? This muscle, which is called the corrugator muscle, is stronger on this side than on that side. But one reason why you might consider Botox at some stage is to reduce this pulling down of the muscle.
And cosmetically, in terms of that crease that I have here, would you recommend I'm ready for work to be done on that?
Well, you're just developing it at rest. You just can see that line at rest. and you can see why it's likely to be getting worse. So you're on the edge of having Botox, definitely for the lines, but the most important reason to consider it in you is to stop that brow drop.
Well, that is not what I expected. Dermatologist Dr Nick Lowe needs to be fully aware about what can go wrong with Botox.
The main thing that can go wrong here is, one is that we could have injected it into a blood vessel and she could have got a large bruise, which can last, obviously, several weeks. The other thing that, had I not examined the muscles very carefully and marked out things, instead of giving you a brow lift, we could have made the brow drop considerably more. And if you just inject straight across Jess's forehead, this would drop down, this would drop down. She'd have a lot of difficulty raising her eyes. If it's injected for crow's feet and it's injected too close to the eyes and it spreads into the eyes, then you can get what we call double vision, because it can actually affect the muscles that control movement.
The big fear with fillers are the permanent ones. I've come a long way since the start of my time examining the issues surrounding the use of Botox and fillers in Britain. It's given me a lot to think about, but now it's crunch time.
Right, this is decision morning for me now. After all the people I've met, everything I've learnt, I come back to Dr Lowe to decide what to do with my face, to go through with it or not. Everything rests in there and in my mind with everything that I'm mulling over at the moment. So I'm quite anxious, actually, because I want to obviously make the right decision for me. But there is a lot swirling round.
The last time I was in this treatment room, I was watching Dr Lowe inject somebody else. Now it's my turn to take the hot seat.
Now, frown deeply. So interesting, you're frowning a little bit more on this side. So I'm just going to mark exactly where I want to do the Botox. Scrunch your nose down. You do have some quite strong muscles here, and that's what's leading to these little vertical lines across the nose. So I'm going to take a photograph now, so we've got a record of exactly, if you decide to have your Botox, where I'm going to inject it. Then I'm going to put on some anaesthetic cream. Okay?
With every click of Dr Lowe's camera, the prospect of having Botox is becoming increasingly real. And to be honest, I'm starting to feel extremely nervous.
The words are jumping around on the page at the minute as I'm just sort of like trying to make myself concentrate whilst in a mild panic of knowing that my decision is hurtling towards me. Yeah, I don't know. Can I have like a small off-camera moment with the good doctor?
Yeah, of course.
Thanks. Can't believe what a wuss attack.
Yeah, honestly, just put your head back and relax. And it's... Yeah, you'll be fine in a second. Yeah, you've got a good steady pulse.
I simply suffered something of a panic attack, the culmination of weeks of worry about these injections.
How are you feeling now?
Yeah, all right. There's just a big part of me going, feeling like I've moved too quickly, and that even though I've done all the research, that I'm actually not ready.
Well, and I don't think that's... and I think that's the whole point. You have to make your mind up. It's not that important for you to have it done. If you feel this way, you've got other priorities, you look great, okay? You know you can have it done if those brows become more noticeable in the future. All right? There's no urgency.
Yeah,
You've got...
majorly anxious. Lying in there today, even then I fluttered as I breathed in. It didn't feel like the step I wanted to take. And you're probably screaming at your telly going, what a wuss, or you might be cheering and going, thank God. But it's the decision that I wanted, that I controlled, and so therefore that's my right. And that's where I'm leaving it.
Once it was only crazy Hollywood stars who tampered with their faces, but now it feels almost normal, like having a facial or your nails done. And I don't think there's anything intrinsically wrong with that, as long as it's done safely and makes you feel good about yourself.
Well, that panic attack shows it's not right for me at the moment, but if you decide you do want injectables, make sure you choose someone reputable who's well qualified. And if you are young enough to have not a single wrinkle on your face, my advice to you, treat yourself to a decent pair of shoes instead.